Hey everybody, I'm Jake Urban from the Jackson Hole Outdoor Leadership Institute. I wanted to talk to you today about what's in my medical kit so that you can live better in the backcountry. In regards to commercial medical kits, it's really important to recognize that, well, ultimately they rarely have what you need in regards to wilderness medicine. They commonly have a lot of Band-Aids, they've got a lot of aspirin, a lot of ibuprofen, and a lot of alcohol pads, all of which, well, in small amounts are helpful, but in the amounts that they come in the commercial units and for what you pay for them, they're generally not a good value. With that being said, I did use a commercial pack and I've taken everything out from it and I've started from scratch. So here's what I've got in my pack. Before you provide care, be certain to stop, assess the scene, and make sure that you're not going to incur an injury as you're trying to provide help. Scene survey just takes a few seconds, but you do have to slow down. Slow down, breathe, observe, come up with a plan, and then initiate your actions. Now that you're going to be providing care, you can also continue to protect yourself with some vinyl gloves. I carry 3 pair of these in order so that I have a pair, and then I have 2 other pair in order to be able to pass out to any other individuals that would be helping. I also carry along some Sani wipes as well, so that once we're done providing care and I pull off the gloves, I can wash up and sterilize my hands before moving on with the rest of my day. Most importantly, we should recognize what the injury patterns that are associated with the activities that we engage with. And so commonly around skiing and climbing, these are velocity sports. Climbing may not seem like it, but when you're taking a fall, you're at a pretty high velocity. And when rocks are falling, they're at a high velocity. And then obviously with skiing, you're moving through the terrain quickly. And so it's not uncommon to see head injuries in those types of activities. And so for me, I ultimately need to be able to manage an airway. Why? Because every time we have a head injury, we generally have an airway issue with the individual. So one, I carry a pocket mask. The pocket mask that I carry is a new mask. It's a little bit more compact, and it also has a integrated OPA, a oral pharyngeal airway with it as well. And so you can cut this to size in order to manage the airway for the individual. And then this actually slots into the mouth, above the teeth, below the lip line. And then you have to actually occlude the nose manually. And so it's a little more compact. It works pretty well. And like I said, the reason why I like it so much is because it's got the integrated oral pharyngeal airway, or the OPA. The next thing I have in here is NPAs, nasal pharyngeal airways. These slot down the nose and ultimately maintain an airway in the upper airway. This is both the OPA and the NPA are wilderness first responder, or EMT, or higher level training. So be sure that you've got the appropriate training in order to be able to manage someone's airway. At the basic level, you can always put somebody into a recovery or a Haynes position, which will help them manage their own airway on their own. If you don't know what a recovery or a Haynes position is, look into one of our courses to learn more. When I move over to bleeding, some of the things that I'm carrying are roller gauze, cling wrap, and this gives me the opportunity to impact deep lacerations in order to be able to provide more pressure in order to stop the bleeding. And then I can do circumferential wraps in order to do bandaging with the vet wrap or the cling wrap. You can also make Band-Aids out of this. You can check some of our other videos for that on the best backcountry Band-Aid out there, which is quite simple, just using a little bit of cling wrap and some toilet paper. Some of the other things that I carry for bleeding is that I do carry a feminine napkin for a couple of different reasons. One, for heavy bleeds, but then also you could be a savior for a female companion as well. I do carry a handful of Band-Aids, just a few. just a small little bit of antibiotic. I carry some coverlet, and so this is just a thin layer that can go over top of a dressing. And then ultimately, I also carry a few steri strips in order to be able to deal with some lacerations, in order to be able to stitch those up and close them. And then I also have some gauze pads as well as an ABD pad as well. You finding everything you need there, Stewie? Another item that I do carry that, while not oftenly used, that comes in big help when it does, is just a pair of tweezers. Gives you the opportunity to be able to pull debris out of wounds, maybe splinters, etc. They don't weigh much, they don't take up too much room. I've definitely benefited from having them along. In terms of splinting supplies, I do carry a manufactured lower leg splint, and so you can slide a ski pole or a stick up the side of this, put some padding inside of it, and then you can lay the appendage, the lower leg, into it, and then you can ratchet strap it together. And so I carry a couple of extra ratchet straps that I leave in my first aid kit, but then I generally have 2 other ratchet straps on my pack as well, or ski straps. I also carry 3 triangular bandages. I use these in order to be able to fix a splint onto a forearm. Could also be used in bandaging. At the end of the day, you can use it to lash anything onto the body. So if you're trying to get any type of compression, these can be helpful. Also carry a pair of trauma shears. So in the event that you do have trauma that needs to get exposed, that's been covered by clothing, we can cut clothing. Generally in the wilderness, we try to not cut clothing, but in the event that you need to, it's nice to have a pair of compact pair of these in order to be able to make short work. In terms of patient packaging, I carry a few different things. One, I carry a tarp. The tarp itself gives us the opportunity to, 1, it can create shelter. 2, it also gives us the opportunity in order to be able to move a patient, so we can actually transport a patient on the tarp. And then finally, it gives us the opportunity to package the patient, keep them warm, dry, and comfortable, and ultimately protect them from the environment. The other thing that I'm carrying is for patient packaging is I'm carrying an external heat source. And so carrying a few different hand warmers and a body warmer. When we insulate individuals, ultimately they're rarely producing enough heat when the injuries are severe. So when individuals have severe injuries, they produce less heat. And so when we insulate them, we often insulate them to the temperature that they are. And so providing an external heat source gives us the opportunity to actually be able to warm patients and get them more comfortable, reducing the signs and symptoms of shock and making it more likely that they'll survive serious injury. Hey everyone, well that's everything that's in my medical kit. Thanks for watching, and thanks for giving me the opportunity to share. If you have any questions, feel free to leave them in the comment section below. And if you want to learn more, hit the big red subscribe button below. If you really want to up your game, go to our website, check out our courses page, and enroll in one of our in-person courses in order to help you live better in the backcountry.